Good afternoon. We are back with Doc Talks, and today we're talking about Achilles pain. So down here, behind the leg, or behind the ankle. First off, again, I guess this is kind of almost a common theme now. Last week talked about some golf stuff, and I referred to myself as a awful golfer. I'm going to refer to myself as a pathetic runner as well. I don't have very high tolerance for running, so this really, it's hit home with me a couple of times as I've ventured out into the running when the gyms have been closed throughout the whole COVID shutdown. So after little bouts of running, 1, 2, maybe on a good day, 3 miles. Next day, pretty lit up back in the Achilles. So we want to talk a little bit about what to do for some of those people.
I wish I could say the same. Well, I'm probably a bad runner now, but I used to be a good runner back in the day. However, I have also dealt with Achilles issues on and off, really issues everywhere. I was hurt a lot, which is probably why I'm a PT now. And we're going to help you today problem solve through, one, most important, how to prevent it, and what it is, and things you can do if you do have it currently to help reduce the stress load and get you safely back to whatever activity you want to do, whether it's running poorly, running less poorly, or doing multi-directional sports, basically anything, because, and you'll hear the common theme with this is doing too much too soon and then your tissues just can't adapt. So let's dive into
He's being humble. He was in collegiate sports, so he actually ran collegiately, so he did have some talent at running. But like you said, so common presentations. Obviously, we just spoke about one, a runner that has maybe taken time off, or they're really trying to hit a new PR and they start to increase, mileage and putting some time in on the track, or they change a surface or something like that. Those are pretty typical presentations that we'll see. Those runners come in and they typically have, an Achilles type pain. So whether it's Achilles tendonitis, there's a bunch of actual diagnoses, and we'll talk about some of that stuff maybe a little bit later. But typical runner ran way too much or loaded way too much, and they ended up having some pain. Multi-directional athlete, your specialties.
Yeah, I've had a few folks, and again, the common trend was we had a couple guys with Achilles issues when I worked in the NBA D League, and it was training camp happened, wasn't training a whole lot for basketball, and then we just ramped up activity levels, and the guy developed Achilles tendinopathy, tendonitis. The cool thing was, though, is by intelligently managing his workload and doing things locally to help him feel better, he was able to get back within 10 days. So to playing full minutes, which was really cool. So again, anyone can fall victim to this when you do too much too soon.
Yeah, very high level athlete, very high mileage runner, whatever it is. It's about load management for this one. This one's going to be a huge load management, understanding how to get those things properly graduated into more and more load. And then another one, this is honestly probably one of the more scary type of maybe an Achilles pain, is a weekend warrior, someone that hasn't maybe ran for a long time and they think they got what it takes to go out and kill it. They're going out for hoops, they're going out they take off in a sprint. They can create some pretty significant damages sometimes, and that's just because their bodies really aren't used to that stuff. So they go from 0 to 100 as opposed to maybe a runner or a professional athlete or something that went from 50-60% to bumping up 80-90%. So those are the people that have a little bit more chance of having those big scary Achilles injuries. I think that's typically what I've seen.
Yep. Yeah. Absolutely.
So something that can help you understand maybe a little bit of your maybe potential injury, or kind of giving yourself a little bit of an evaluation on whether or not you should come see one of us or go get it evaluated. We usually like to look directly at the area, so palpation, or what we do with our hands, we can kind of feel around in the actual tendon itself. So finding your Achilles is pretty easy. You're looking at the back of the heel, and then looking at where the gastroc or the calf comes down and it turns into a little bit more of a ropey feel into the back of your leg or the back of your ankle. That area is about 2 to 3 inches on most people. If you're ginormous, it might be a little bit bigger than that, but typically we're looking at a couple inches through there. That's going to be the actual tendon itself. When we're touching some of that stuff, if there is maybe like a BB size or a pea size bump in through there, that could give you a little bit of understanding there might be a little bit of an irritation across the tendon, and then we're starting to have some of the healing components start coming in there and try to kind of mat some scar tissue down in there. So those are what are called nodules that we'll find, and we'll typically tell patients, yeah, there is something kind of going on in there if it's been around for a little bit of time.
Yeah, and the other big thing too is if you have pain or soreness to touch on that specific area, in terms of the back of your ankle, that's usually a telltale sign that your Achilles is probably a little bit sore or inflamed, and you could benefit from either getting work with us in person or following some of the tips that we're going to give you so you can get back on track. Because this is not a soreness that you want to push through. This is not like, and as we'll talk about, the classic, you get a good workout sore. This is a little bit of a different animal, and you have to respect that.
Absolutely. Another thing you could do to kind of give yourself an evaluation or just look at some of your body is looking at the width between right and left Achilles. If you're having single-sided pain, so say I have just left-sided pain, looking from the back or having someone look from the back and see if there's like a big difference in size. If one's this big and the other one's this big, there's something going on there. That needs to be evaluated because there's some sort of tissue damage that's caused that stuff to kind of puffin, not the bird.
Puff, yes.
Puff up and cause a little bit of asymmetries there, a little bit of a difference from side to side. So looking at nodule, kind of giving yourself a little bit of a touch and a feel through there. See if you can slide your fingers across the tendon, and if there's a bump across there, that could give you an idea. And then again, visual, look to see, expose that stuff and have a friend or look in the mirror or take a ankle selfie, if that's what you want to do, and compare side to side. I heard those are pretty
I take
popular.
my daily ankle selfie
Popular
for Instagram every
nowadays.
day.
So we got ankle selfies. You can post it on Instagram and ask other people too. So we looked at and then the location of swelling. So this is something that's kind of interesting. Looking at the tendon itself, if there's swelling directly kind of on the tendon or where that little ropey spot is. That could mean something, and then if there's swelling that's going to be around it or not directly on the tendon, it might not just be the Achilles is messed up. There might be something else that's kind of going on, and there's other things that can be injured that are really close to the Achilles, posterior impingements, all sorts of stuff that can happen back there. We just recently had a patient that had actually a chip fracture back there, and he was given a diagnosis of Achilles tendonitis. So it was the wrong diagnosis and the wrong kind of interventions because we were trying to load the tendon, but it was not a tendon issue. It was a bone chip or a bone fracture. So making sure that we understand the difference in location of swelling and the locations of pain, very, very important. So not you just kind of blindly start going after some of those things. And I guess that's why an evaluation is pretty important.
Yes, very much so. Especially if you try some of the things that we recommend and you're not seeing much improvement. You might need the guidance of someone like ourselves or a similar practitioner. So
Absolutely.
Don't hesitate to call us. Let's talk, we've kind of been alluding to this. Let's talk about load management because in our eyes, this is probably the most important thing, both from prevention and recovery of Achilles tendonitis or any Achilles issues. So this is different from delayed onset muscle soreness. You have a good workout, you get ripped like Kyle over here, and you wake up and you can't walk because your glutes and your quads and all of that are sore. That's not necessarily a bad thing. In fact, some of the delayed onset muscle soreness are protective mechanisms that happen via stuff in your spinal cord to make sure you ought not do that again. Pretty cool stuff.
Or at least not for a while.
Not for a while. Typically, that's going to subside within 24 to 72 hours. This is different. Because the way that tendons respond to load is slightly different than muscles. So if you're getting local soreness in these tissues, it doesn't mean that you had a good workout in your tendons. It means that the tissue is not adapted yet to whatever it is that you did. So say you went on a 5-mile run and the last mile run you did was 0 forever. If you're starting to get soreness in the tendon, you have to give your tendons time to catch up and respond to the loading. So, and I don't know what you recommend. Typically, I recommend if you're getting some tendon soreness, you probably want to wait about 2 to 3 days before re-exposing yourself to whatever it is that you did, and then making sure that you do so at a smaller amount. So if you ran 5 miles, and that's a problem, you might want to start with about 50% to be on the safe side. So like 2.5 miles.
Yeah.
Give yourself a couple days to get used to that, and then slowly bump the mileage up over time.
Yeah, but I mean, exactly like you said, you have a time frame in between there. So you have a couple of days for your tissues to be like, okay, I can chill out a little bit. It doesn't feel angry every single step. When he was speaking about the hip, or like the maybe the quads and the hammies and the calves all being sore, that's like the soft tissues that you can feel, you can kind of squeeze and contract. The tissues that are like really localized to like a joint or something that doesn't feel like it can actually squeeze. You can't see a bicep or you can't see like the actual bicep tendon contract, but you can see the bicep contract. Those are the things that are way more exposed to risk of actual creating those big pains. That's what we're really talking about here, is the tendon itself. Getting that type of pain in the tendon, and that's going to be needing time to heal and become less sensitive, and then gradually get back into that. But I love the recommendation of 2 to 3 days. Just like anybody, it's going to be probably different between every single patient that we might be working with, because some people might be really deconditioned and it takes them 5 days before they can load it again. So again, having the concept of just giving yourself a little bit of time before you re-expose is huge, and don't stack pain on top of pain. So if you know that you went out and ran yesterday and you're like, well, my training log says I need to do this. Your training log doesn't understand what you actually feel. So your feeling of pain trumps what your training log should say. And I think you can look at anybody that's made it and performed at a high level for a long period of time. They'll understand that, and they'll say, yeah, you got to listen to your body. You got to have some sort of sense that that's going to be a guiding factor in what you do.
Mm-hmm. Yeah, absolutely. And it's also important, a lot of this stuff, with preventing this from happening in the first place. If you do too much too soon, you're going to be at risk for having one of this. So making sure that if you are doing some activities and you haven't in a while, start with a low amount and then slowly beef up your amount that you can do over time. There's a good rule of thumb, and there's actually, I think, a little bit of research to support this. I'm sure you've heard that 10% increments of increasing either mileage, if we're talking about a runner, or you could also argue playing time on a field, or if you're a weekend warrior doing your sport. Mm-hmm. You know, if you want to play basketball and you haven't picked up a basketball for months because of the coronavirus, you might not want to play 5 games of 5-on-5 the first day. Maybe it's 1. See how you respond, and then you can bump up the amount of time that you play accordingly. So that 10% rule is very good and very useful.
Looking at what would be next, so what would you do if you wanted to start loading these tissues again? How would you even understand what to do? We want to go through kind of like maybe a pyramid, or an understanding of what comes first, second, third, fourth, fifth, and all the way up to getting you back onto what you're doing. Typically, we like to look at what's called an isometric. An isometric is going to be something that contracts. Remember, we're talking about the meaty muscle compared to the tendon, so we contract the muscle, but we're not actually creating any movement at the joint, so not creating any movement down here. That gets load on the tendons and the muscles, and it gets the body to understand, hey, there's load there, so I can recover. I need to bring a lot of nutrients to the area. But we're not maybe going through a lot of the big stretching of the tendon, or we're not going through a lot of movement at the joint level. So an isometric will probably be one of the first things that we're going to look at for starting to treat or starting to load these tissues efficiently.
Absolutely. And the nice thing about isometrics is there's good research out there showing that these can be some of the most helpful exercises that you can incorporate for pain. So if you got a hot Achilles, these would be the moves that we would push you to immediately, and you can do a lot of them with few repercussions to the tissues themselves, as opposed to some of the other stuff. It's a little bit more intense. That has a little bit more of a risk-reward ratio with it.
Yeah, especially if it's hot, like you said. You know, you're not going to jump into jumping, or you're not going to jump into running, because those are the things that actually created the irritation. We need to regress, or we need to be at a lower level of function before we get back up to a higher level of function.
Yep.
All of this stuff, you know, a lot of this comes back to kind of humbling yourself and bringing yourself back down to a level where you know you have to work on something, and then graduating back up into those. And sometimes that's hard for athletes, for people that are weekend warriors, runners, professional athletes. They don't like doing the stuff that seems super easy, but it is very, very much needed if you want to have longevity and you want to get over the current situation that you're in. So when we're looking at maybe a sprinter type ISO, or something that's going to translate to running a little bit, I can use this wall here. I don't need very much in terms of equipment, because I need something that is going to be immovable. Even though this wall is it's pretty sturdy, I don't think I'm going to be moving it. But setting myself up into an ISO is pretty easy, and then we can look at different ranges of motion at the joint level, and then load it. So what I mean by that is, if I'm in this position and I'm doing an isometric load on my right side, so that heel that's back behind me, and I'm loading my Achilles here, I'm going to keep it in the same exact angle, and I'm going to try to push into the wall. So notice that I'm not changing the angle at my ankle, so it's not actually doing this. I'm not doing movement at the ankle. I'm just creating the same angle, and then I'm creating tension through the whole tendon and the gastroc and the calf and all that stuff. So those are really good positions to start with. So you start creating load, but you're not going through that springy running feeling that actually got you in that situation. Now, when I was saying you can change the position or the angle, your heel can go higher, it can go lower. I would say that if you are having a little bit of the pain in the back of the ankle, in the beginning, you're not going to want to drop all the way down into like a big heel stretch. That might be a little too aggressive, so we keep it short, keep it shortened in here, and then we start increasing the load. As we get better, then we can start getting a little bit more tolerance to the greater range of motion. So easy wall isometrics. I think an ideal would be anything above 20 seconds all the way up to 90 seconds. If you can hold that contraction, 20 to 90 seconds, and if you can go through multiple rounds of that, I usually prescribe having 4 to 5 rounds of that, and then you can kind of repeat that to get pain to start coming down and get your tolerance a little bit higher. So wall iso, good one for getting your pain to start to diminish.
So what you can do in this position is you could just have a seat at your desk and get your knees on the underside of your desk. And while you're there, you can simply push up, so your knee, you don't want to tip your desk obviously, but put your arms down so your desk stays sturdy and push your knees up into the desk. That's also another great way to perform an isometric with the same recommendations that Kyle made in order for you to get the same change. It's kind of like that machine at the gym, you know, the calf raise thing when you're sitting. It's basically that, but you're not moving. And the key is you want no movement with this. It's putting as much force as you can into whatever surface, whether it's the wall or this. And that's a great way to start introducing some of the loading stuff that we talked about in this talk.
When we're talking about getting those to be loaded in and trying to be in a pain-free manner, if you want to grade yourself on how much pain you're allowed to have during that, it's nothing more than a 2 or a 3. You can't go above that. If you're going above a 2 or a 3, you might be getting into the kind of the damage zone, or getting those tendons to be a little bit more sensitive. So maximum 2 to 3 out of 10, and then that should drop back down to your baseline before you started with your ISOs. So make sure that drops back down. after or post isometrics that you're going to be doing. And just real quick on his machine that we're doing this on, now that gyms are open, load it all the way up, put the pin at the very bottom, push up into that. I think that's an easy way. That's a little bit harder sometimes to set up, but that could be, go to your gym and start hitting those up a little bit.
You could also do a heavy leg press too.
Leg press is another good machine for that.
Really good. Just
Yep.
making sure load it up so it can't move and you're just pushing as hard as you can.
Yeah, for me that'd probably be like 1 plate. Zach would probably be like 100 plates, but it is what it is. Real quick, so another thing to consider to make yourself a little bit better capable for getting into your running, to your jogging, to your whatever multi-directional stuff you wanted to do is looking at the ankle and toe mobility. So reestablishing your ankle's ability to dorsiflex and plantar flex. If you see a big difference from side to side, there's a lot of stretches that we can prescribe patients for that, but getting those to go through big ranges of motion and even going into some rotational motions too will help free up that complex so it's not going in the same exact pattern that it has in the past. Would you say that's a pretty...
Yeah, absolutely. Because if you have any restrictions in motion in your ankle or your foot, that's going to change the loading strategy through your leg. And so certain areas of the tendon might be more overloaded than others just based on the position that your body can or cannot get into.
Yeah.
So making sure that you restore all of the motion that's available, that ought to even out the workload distribution through the tendon and allow you to safely progress to whatever it is you want to progress to.
Love that the concept of just having more options available for movement and then letting different tissues take over at different points. Very, very key for decreasing load. And then lastly, looking at toe mobility. So if these were my toes and your toes always look like this and you can't do anything else with them, that might be a pretty big problem for overall foot health and being able to accept load and then kind of push off your foot. So getting your toes to be able to get into what's called splay, or getting your toes to be a little bit wider is a very good adaptation for increasing options again, right? So if our toes are here and this is the only thing that they can do is move from here to here, not good for overall distribution of loads. But if we can start getting them to splay and then our big toe can do this, our pinky toe can do this, those are very good things for lower leg health and tendon health.
Yeah, I would agree.
So looking at toes, this is pretty typical for me to if I see a athlete that does not have great toes. So I'll have them. It's called toe yoga, just toe mobilization. So I'll take them and have them put their fingers in between their toes, and then I'll have them go through ranges of motion. So if I were to do this with my foot, I'll show you guys my foot. So if we are here and I put a finger between these toes, kind of gross because my feet are a little hot, but now I start to increase there and I'm going through flexion, extension of the toes. My toes just pop like crazy. I don't know if you could hear them, but they popped and clicked and all that stuff. But my toes have been stuck in that shoe for too long, and so they're a little bit stiff. So if I don't do this, it'll keep on kind of getting worse and worse. So again, getting your toes in between or your fingers in between each of your toes and going through some good flexion extension, key for at least mobilizing those. And then you have to start training after that, but we'll talk about that some other time. But that'd be a really good one to start to get your toes to be mobile again.
Cool. All right. Now's my favorite part of the segment. Let's make Kyle suffer.
Oh, crap. Cramp City, here we come.
I'm not going to get you to cramp this time.
Are you sure?
I hope. Jeez. So, man, we got some work to do. All right, so the first move, and there's a nice little test that you can look at that all you need is just looking at your ankle range of motion. So if you face away or get a camera, right, and just look at your heels, that can give you a lot of an idea in terms of what position you like to be in when you are doing, or when you're just standing and walking. So some people are going to have a foot that's more turned in like that, or a flatter foot, just like so. Some people are going to have a high arch where the foot is shaped that way. So whatever shape your foot is, which if you can get that view, that can let you know that you're probably biased more towards that and you should go the other way. So if you're someone who's got a high arch, you want to try this move right here. Kyle, I'm going to have you lie on your side. So I want your foot right here. Your left foot's going to be right here. Push yourself up. Push, 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 push. Boom. All right, cool. So this is going to be the starting position for Kyle. And what I want Kyle to feel on this is top side butt. Okay. Sorry, Instagram's not seeing all of Kyle. There we go. All right. So we got top side butt. That's the goal that Kyle should feel with this. If you have a high arch, this is a great move. What I'm going to have Kyle do is I'm going to roll him a little bit this way. I want you to tuck your hips underneath you, so belt buckle to belly button. If you've been following Doc Talks, you know I've been talking a lot about that. And then keeping that, Kyle, you're going to press the inside of your foot into the wall. And hopefully you should feel your top butt doing some work. We can see it back here. It's pretty cool. And then all I'm going to have Kyle do, kick out a few breaths in that position, silently in through the nose, let out the longest exhale possible. We should be in business. Feel all right?
Yeah.
Awesome. If you want to kick it up a notch, Emeril Lagasse style, which Kyle most certainly do, you can go up a little higher, bend this knee just a little bit more right there, and you're just going to drive more of the same positioning. So tuck, push the inside of your foot into the wall, and my man should be getting glute city. If you listen close on Instagram, you can hear it sizzling.
Yep, sizzle city.
Cool. Now, let's say you're a person with a flat foot. What I'm going to have Kyle do is, Kyle, could you put your head on this side, legs on this side? You're going to go the exact opposite direction. So what I'm going to have Kyle do this time is this foot's going to be right here. I want this leg to be straight. We'll say the down leg or the straight leg is the leg that we're going to be doing some work with, okay? What Kyle's going to do is he's going to do the same tuck. Yep. You're going to, this time, tilt your arch up. So instead of pushing down, you're creating an arch in your foot. And then you're going to lift your leg up. This might be the cramp city for Kyle. He should feel a lot of groin on this one.
I feel good on this one.
Really? Nice. Oh, hang on. Let's fix that. Lift up. Okay. Same 5 breaths. Or same few breaths. Again, this one is great to help create that arch in the foot, which is what we're trying to do. You just have them hang out in that position. Cool.
There it is. So those are the talking points. Remember, common presentations. These are our runners, our multi-directional athletes, our weekend warriors that are starting to kind of get back into things. Make sure that you take a look with your fingers, take a look with your eyes at the area, kind of give yourself a little bit of a self-assessment, understand where the swelling is so you can make some decisions on whether you need to go see someone about it, or you can start to manage things on your own. Load management is very important. Don't stack pain on top of pain. Give yourself breaks. Figure out that perfect recipe for you before you start getting back into whatever it is that got you into the position that you're having pain in. And then remember, you go isos usually first, trying to get contraction across the muscle, the tendon, and then you start building capacity. We didn't really talk about that, so we didn't have enough time, but maybe in another segment, we always talk about the progression of loads. We always talk about like what needs to come first. So capacity first, strength, speed, and then finally acceleration. And then make sure you're looking at your ankles and your toes.
Yep.
Ankles and toes, and like where those things are going to be positioned at.
Yep. And if you do those things, you ought to be able to return to your sport or activity safely. And if you are taking our advice now, you can probably put Achilles tendon at bay and not come in to see us for aches or pains.
If you do, let us know, and we'll be back next week for Doc Talks. If you guys have any topics that you would like us to talk about, shoot them in the comments, leave messages to either Zach or I, and we will make sure to get that topic up there.
Yes, and also should we make the announcement about what
announcement.
happens on Monday?
Okay, so announcement, we are back in action starting Monday. We got the go ahead to get back out and start training on the gym side, which is very exciting for us because in our eyes we have health as fitness, healthcare, and all of the spectrum in between. It goes from table to turf. We want to have that full spectrum of care. So we were missing a couple of pieces, not being able to train our people effectively. So now we're getting the full spectrum back. So if you have any fitness, healthcare concerns, we're your people, and we'll get you there.
Yep, and especially if you're wanting to get back to activities safely with few issues, a great way to introduce loading that you might not normally be able to do because all the gyms were shut down. Elevate Sports Performance and Healthcare is here to help you with that.
Monday, we're here for you. Until next week.
Signing off. Stay tuned.